morning. Thank you for joining us. This is Dr. Doni TV. Yeah, quick one. Nkechi, I want to ask you, why are you always worried whenever you come to hospital and your doctor tells you you are having fibroid? Why are you always? We've told you people several times that this thing called fibroid, not saying a cancer, but it's not saying a tumor, and a benign form of tumor. Okay, so sometimes make you not the worry when your doctor tell you say you are having fibroid. The only thing when go feel happen now to do you surgery to remove this fibroid. Yes, you get plenty things when this fibroid they come down with. You will see some of them when they see their period go come day heavy. Some of them self go they feel pain for their lower abdomen. When some of them touch this their belly, then go find out see then they feel some swelling inside. These are the things that are associated with this fibroid, and sometimes it doesn't even cause any harm. It's only when you find out that yes, when you are seeing your period will be very painful, and that is when you will be worried about it. But when it gets to that point, you find out that some people, when you tell them the next thing they will ask you, say, doctor, no medicine to take. But I want to tell you, say, yeah, true, there is medicine when you go use take to the strength, they bring the level of the swelling of this fibroid down. But you don't go feel come out and totally. Even the surgery when they talk surgery, get how you go still do surgery. Some of those small units fibroid, like 1 cm, 2 cm, some of them then go live and there you go. So the only ultimate thing to say this fibroid no day, not to do hysterectomy, to remove the womb totally where the thing is. And you cannot do hysterectomy when one has not completed the family cycle, isn't it? So I want to tell you, whenever you are diagnosed of uterine myoma, what is called fibroid, you don't need to panic, you don't need to worry. In case you relax your mind. And this thing has been said to be commoner in the reproductive age group. As soon as you pass some age above 50, the regression, the growth of this uterine myoma will reduce. It will not be growing progressively like it's growing in the reproductive age. Okay. Now you want to ask, what are those things that causes this fibroid? But I want to tell you, Nkechi, the cause of fibroid is unknown, but there are risk factors that are associated with it. And what are those things? When it runs in the family, you find out that some people, great-grandmother has fibroid, then their generation will now come and have it, okay? And the people who are within the age group of reproductive age group can have it. What of hormonal issues? When there are hormonal disbalancing, fibroid can happen, okay? So these are those things that can cause it. And when you're talking about the management, like how we said, fibroid, so to remove them, now only hysterectomy go fit say fibroid no there again. But when you do what they call myoectomy, you find out that some of them will still be there. Some may go, especially when it's solitary. When it's one, you can remove it. But when it's multiple everywhere, one can be left behind, and those one can later grow if the pregnancy did not come in at once. And there are kind of requisites we make when we are telling people to do this surgery. Most especially people who want to get married can actually subject to surgery when you know you want to marry and you want to free that space so that when pregnancy is occurring, this fibroid cannot suppress the fetus that is forming. We could do like chances, but when the fibroid is small, we don't bother. We want you to relax because one is not causing any harm to you. It's not like all those mitotic lesions, all those cancer, something when we say them go they grow, you go they lean. No, you know they like that. So, Nkechi, my sister, I want to tell you today, whenever you go hospital next time, and doctor tell you say you get fibroid, no panic, relax. Tell and say, doctor, what thing I go do next? Be happy. Say, what thing I go do next? You know, because when you are well inside you, that is when you will be fine. You will know that yes, there is nothing wrong with you. But when you start panicking, that thing can lead to another thing. You start losing weight. You cannot eat and all those things. Because you are not eating, you start losing weight. All right. So please, I want to tell you, Nkechi, today, not the panic. You when be cosmos, when be husband to Nkechi, encourage Nkechi, tell and say, see how it be, no fear, fibroid, not the key. Have a lovely day. Thank you.